What clinical and laboratory parameters are needed to evaluate a therapy for achievement of the desired therapeutic outcome and to detect and prevent adverse events? BNP level monitoring. The brain natriuretic peptide levels of the patient is high, so it is advisable to monitor his BNP levels. BNP is a hormone created by the heart. A high level of BNP indicates heart failure, and therefore routinely monitoring BNP may aid in determining the current state of the patient.
Heart failure, a condition where your heart is unable to provide enough blood to the body and can take years to develop inside your body. The narrowing and blocking of blood vessels caused by hypertension increases your risk of developing heart failure. High blood pressure adds to your heart's workload, which make it more difficult for the blood to travel smoothly and easily throughout your body, causing your heart to work harder. In order to cope with the increased demands, the heart thickens and becomes larger. While it is still able to pump blood, it becomes less efficient. The larger the heart becomes, the harder it works to meet your body's demand for oxygen and nutrients.
Hypercholesterolemia. So in order to detect this disease, blood test is performed. So what are the blood tests to perform? So first is the total cholesterol, which is the LDL, low density lipoprotein, or as the bad cholesterol, ranging from less than 100 milligram per deciliter. And the HDL levels, which is the good cholesterol, ranging from 60 milligrams per deciliter. And lastly is the triglyceride test, which is the normal kay below 150. So when there is too much cholesterol in your blood, it builds up the walls of your arteries. It calls to atherosclerosis, a form of heart disease. So the arteries become narrowed and the blood flow through the heart muscle is slowed down or blocked. So the blood carries oxygen to your heart. And if it's not enough blood and oxygen reach to your heart, you may suffer chest pain. If the blood supply portion of the heart is completely cut off by the blockage, the result is heart attack.
Blood glucose test is a measure the glucose levels in your blood. Glucose is a type of sugar and it is your body's main source of energy. A hormone called insulin helps move the glucose from your bloodstream and into your blood levels. Glucose testing is primarily done for people with type 1 diabetes and type 2 diabetes and gestational diabetes. If you have diabetes, you should avoid eating sugar, sweetened beverages, trans fat, white bread, pasta and rice, fruit-flavored yogurt, flavored caffeine, drinks, and dried fruit.
So because of the decreased volume of the blood pumped out by the heart, the volume of the blood in the arteries is also decreased, despite the actual increase in the body's total fluid volume. An associated increase in the amount of fluid in the blood vessels of the lungs causes the shortness of breath because of the excess fluid from the lungs' blood vessels that leaks into the air spaces and institution in the lungs. This accumulation in the lungs is called the pulmonary edema. At the same time, accumulation of fluid in the legs causes pitting edema. This edema occurs because of the buildup of blood in the veins of the legs that causes leakage of fluid from the legs capillaries into the interstitial spaces.
The cardiac muscle isoform of troponin 1 is uniquely expressed in the adult human myocardium, and an increase in its circulating levels is highly indicative of myocardial injury. The muscle cells in your body need SAK to function. SAK is a protein. It can rise after a heart attack, skeletal muscle, or too much alcohol in your body. CK shows that if your test is high, you may have muscle or heart damage.
What information should be provided to the patient about the medications used to treat his heart failure? First is aldosterone, 25 milligrams to be taken orally every 12 hours. It may cause gynecomastia in men. It is the enlargement of breast tissues in men. Losartan, 50 milligrams to be taken orally every day. Avoid taking grapefruit juice, as they may increase risk for severe side effects or damage your liver, leading to kidney failure. Carvedilol, 6.25 milligrams to be taken orally twice a day. Best to take carvedilol on a full stomach or to be taken with food. Cholesterol, 2 grams to be taken orally every day. Take it with food. Aspirin, 325 milligrams to be taken orally daily. Avoid eating green leafy leaves. Insulin aspart. Educate the patient on how to administer doses of insulin via subcutaneous route. Abdominal region, buttocks, thigh, or upper arm are the routes to administer through a 45 to 90 degrees angle. Do not use the same syringe and site when administer doses. Monitor for possible hypoglycemia.